A healthy nation begins at the primary healthcare level. The Basic Healthcare Provision Fund is changing this story. Through sustainable financing and strong accountability, the fund is strengthening primary healthcare facilities, improving service delivery, and making sure care reaches the people who need it the most.
One of the major vehicles that we are using in our effort to transform primary healthcare is the Basic Healthcare Provision Fund, which was established in 2014 under Section 11 of the National Health Act. The Basic Healthcare Provision Fund is an anchor for our sector-wide approach and provides funding for an additional resource base for subnational units, that is our states and local governments, to leverage upon in our collective bid to enhance access to primary health care across all parts of Nigeria.
For ensuring that there's effective governance and accountability for the BHCPF actually starts from the actions and the leadership of the Honorable Coordinating Minister through the Ministerial Oversight Committee. The revised Basic Healthcare Provision Fund guideline for June 2025, which we popularly call BHCPF 2.0, it's not just a document for the BHCPF, but actually the testament to reforms that is ongoing across the entire health sector to ensure three things key. One is transparency, accountability, and more health for every naira spent.
The BHCPF and the enrollment into health insurance helps people access care without bearing the financial burden of care, particularly for the poor. And at the moment, about 2.7 million poor and vulnerable Nigerians across the country are covered by this. And those numbers are increasing as we keep expanding this. Revise the way the funds and the premiums are allocated. We've reduced the number of the amounts that goes to overheads, and we've pushed more money for the actual clinical care. So more money for capitation and fee for service, and less for the administrative overheads. And this is consistent with good practices so that in insurance terms, what they call the medical loss ratio, so the amount of money you put aside and you incur that are due to medical costs that you're paying, we make more provision for that because that also translates to improvements in quality of care. The last thing just to mention in terms of the innovation is the concept of risk and risk management. I mean, insurance is business of risk. So we want to make sure that when you're covered, no matter what happens to the state health insurance scheme, even if they go bankrupt or whatever, that NHIA can reinsure and make sure that you do not lack services, and we will make sure that the hospitals keep getting and the PHCs keep getting reimbursed for your care. So that reinsurance function where we pull all the risk and all the resources centrally, so that when there are those situations of financial risk and the pool of funds are no longer enough in that particular place, maybe because there is an outbreak or there are certain things, that risk is reinsured, and NHIA helps pull and bear that risk as the risk bearer for the entire scheme. And this is clarifying the mandate we have.
Before the coming of this support, it has never been so easy with us. It has not been easy with our people, because people here are predominantly farmers with few businesses that are just petty in nature. And so in terms of their billing, in terms of their finance, when it comes to health issue, there were a lot of issues, where instead of them to come to the facility to access services, they will resolve going to traditional attendance and traditional means so that they can source themselves out in terms of health matters.
I have been here for the past 2 years with the pure total number of ANC 20 or 25 in a month, OPD 300, general attendance 500. But now, with the intervention of Basic Healthcare Provision Fund, now we have the total number of ANC new. We have 70, 75 in a month. Then the total overall, both new and the revisit, we have 300, 400 in a month now. Then for the OPD, We have the fewer total number of 300 in a month, but now it's more than 1,000. Sometimes 1,500, 1,010 in a month. So there is increase of data in the facility with this intervention of basic healthcare provision funds. Then before, I have few staffs in the facility, but now with this intervention and with the patronage of the facility, people are coming. Then I have a lot of staff now, not like before. Voluntaries are here, payroll staff are here. So we are doing the work successfully.
We're increasing the amounts that are going to each facility from 300,000, 750 per quarter to either 600,000 or 800,000, depending on whether you are a high volume or a low volume facility. In addition, we have accountability mechanisms around it. We're rolling out a financial management app that basically is an accounting software that we can now begin to track where the money is going. What happens is that the BHCPF facilities are providing 4 to 5 times more services than the non-BHCPF facilities. So even though there are a lot more non-BHCPF facilities, if you look on a per facility utilization rate, the BHCPF facilities are more able to serve many more Nigerians.
Da wancan asibitin na kusa da shi daga baya na dawo nan. To nan din ya fi mun kusa da inda na fito, shi yasa na zo nan. To bayan na zo nan sai na ga nan din ya fi mun can saboda yadda aka kula da ni a nan ya fi mun can. Kuma shugabanninmu gwamnati godiya ne za mu musu, gaskiya muna godiya sosai da irin wannan alkhairai da suka mana. Domin gaskiya akwai sauki sosai, mutum ya fara daga ciki har haihuwa bai kashe komai ba karamin alkhairi ne ba. Mun gode sosai.
First, for the accident victims, NEMSAS leverages NCC's deployed toll-free National Emergency Access Number 112, in addition to emergency access numbers deployed by various states. We have also worked with states across the country. Already 30 of the 36+1 states have established necessary structure, the governance framework comprising of SEMTEC and SEMSAS, which oversee the emergency evacuation and treatment operations. They've also mapped out emergency assets, including ambulances and emergency rooms, which met quality criteria, and they've established state emergency call centers.
That for health security, there are specific competencies that are required. So the plan is that let's look at what kind of health security workforce do we need that can now help build up at the subnational level. You understand? It's a tough task, but again, it's a challenge to us, which we're ready to face.
So I'll encourage everyone to sign up to get enrolled in health insurance. Cover yourself, cover your family, and also refer to loved ones, because paying out of pockets is a very risky way for one to live their life. So get insured so that your care is covered and is paid for.
The BHCPF is a catalytic fund for primary healthcare backed by law, and that's why we know it to be sustainable to make a difference in the healthcare of Nigerians.